Good morning. My name is Dr. Mary Stephen. Welcome to the first WHO Africa briefing of 2023. Today, we will be focusing on COVID-19. We will look at the overview of what we expect for this year. And we also have experts that will update on the latest development. But first, some housekeeping. We have interpretation in French and English. Please, you can go to the bottom right-hand corner of your screen, click the globe icon and select your most preferred language. Elizabeth?
Oui, bonjour à tous, ce sera Vincent. Donc, vous pouvez choisir la langue dans laquelle vous voulez suivre la conférence de presse en cliquant sur le globe en bas à droite de votre écran et en sélectionnant donc la langue de votre choix. Bonne conférence à tous. Over to you, Dr. Mary.
Thank you, Vincent, and Happy New Year to all. So joining us from Geneva is Dr. Matshidiso Moeti, the WHO Regional Director for Africa. And now I will turn over to Dr. Moeti to introduce our panelists. Good morning and welcome, Dr. Moeti. Over to you.
Thank you very much, Mary. So good day, bonjour, bon dia to all the journalists joining us today for this first press conference of the year, and a very happy new year to you all. Our discussion today will focus on the latest COVID-19 trends in the region as the fourth year of the pandemic gets underway. I'm delighted and hope to soon be joined by Dr. Wilhelmina Jala, the Honorable Minister of Health of Liberia, a country that rapidly scaled up its COVID-19 vaccination coverage, and by Professor Tulio de Oliveira of the Center for Epidemic Response and Innovation at Stellenbosch University in South Africa, and also the director of the KwaZulu-Natal Research Innovation and Sequencing Platform, who has played a leading role in building genomic sequencing capacity on the continent. A very warm welcome to you both. We're beginning 2023 on a positive note. In the first 3 weeks of the year, Africa has recorded around 21,000 COVID-19 cases. This is a 97% decline compared with the same period last year, even if we're seeing increases in South Africa, Tunisia, and Zambia. This is the first month of January that is not marked by a post-festive season surge in cases since the pandemic began. Of course, testing is low too, but most importantly, hospitalizations for severe COVID-19 have reduced markedly, and weekly deaths have dropped by 99% from the level reached in the first 3 weeks of January 2022. With the evolving pandemic trajectory, we are hopeful that the continent is transitioning from the emergency response mode to living with the virus as a new normal. In fact, that is what we are doing on the continent now. But despite the low number of cases, countries must maintain the capacity to rapidly detect any upsurge at the local level and immediately scale up their response at the first sign of an unusually high number of cases. Investments in the COVID-19 fight over the last 4 years have yielded successful results that will stay even beyond the pandemic. The region is better able to cope with the virus, and its health emergency response systems have been bolstered. In addition, capacity for intensive care will benefit other health problems. For this, I'd like to thank our member states and partners for working with us day and night to protect the people's lives. This success is only complete with our connections to communities. We've seen the centrality of community in this pandemic with the involvement of community-based organizations as trusted messengers and communicators working to anchor grassroots across any given level and ensuring that health centers and community clinics continue to provide the most appropriate quality of care. But variants continue to circulate and a resurgence is still possible. Botswana and South Africa have detected the XBB 1.5 Omicron subvariant, one with the sublineages with public health implications. So far this year, Almost 1,900 sequences have been carried out compared with 7,625 in January 2022. Sequencing is crucial to keeping track of variants and helping to mount a timely and effective detection and response. The capacity WHO and partners have helped countries to build in genomic sequencing is now being used to detect other diseases such as Ebola and tuberculosis. Timely data and the investment it took to create real-time information for public health has been invaluable to us and a critical part of our success in reaching vulnerable populations. We want to ensure long-lasting investments in improving access beyond the pandemic. Whether it is COVID-19, influenza, or cholera, having timely data and the health ecosystems ready because of the COVID-19 investments will be a key strategy for Africa. On COVID-19 vaccination, over the past year, African countries stepped up efforts to broaden coverage through campaigns and other initiatives. To date, almost 30% of the continent's population has completed the primary series of vaccinations as of the 23rd of January 2023, up from 7% at the same time in 2022. Vaccination among high-risk populations has had some progress, with 41% of health workers fully vaccinated in 28 reporting countries, and 38, so almost 40% of older adults in 23 countries. But there is a need to reach higher coverage in the most vulnerable groups, and of course, they need to get their booster doses too. To ensure we continue to expand coverage, in addition to vaccination campaigns, it's important to integrate COVID-19 vaccines into routine services. We must ensure that the most vulnerable can still access vaccines when they are part of these routine services. And as I speak, 12 African countries have started this, and we're working on expanding this group. Political determination to address future inequity has led to a movement to produce vaccines on the continent. This is a very important outcome of the pandemic. And similarly, we've embarked on the path towards an international instrument for future pandemic preparedness that aims to strengthen health emergency preparedness, response, and resilience by addressing gaps in health emergency governance, functional systems, and financial mechanisms. The principles of equity, inclusivity, and coherence will be at the center of the new instruments. COVID-19 response cannot sustainably exist in isolation from other health services. So integrated, people-centered health services focusing on equity, including on gender and on community engagement, remain a priority for our region. So the pandemic is not yet over. COVID-19 variants continue to circulate, which means that the pandemic can take an unexpected turn. We must not lower our guard, and by ensuring adequate vaccination, especially of high-risk populations, as well as capitalizing on the advancements made in pandemic control over the past 4 years, we can effectively tackle any upticks and surges. While the threat from COVID-19 is decreasing, we're growing more concerned over, for example, cholera, which is now affecting 10 countries in Africa. The increasing number of countries experiencing cholera outbreaks is putting extreme pressure on limited global supplies of cholera vaccines. So we need to continue with our fight overall to address a broad range of health threats. Thank you once again for joining us, and I look forward to our conversation on these important health issues in our region. And again, a warm welcome, Professor Tulio and Minister Jala.
Thank you very much, Dr. Moeti. And the minister is having some technical problems. So we'll start with Professor Tulio. Prof, turning to you, what can we expect from COVID-19 variants in Africa this year?
Yeah, good morning, good afternoon to journalists around the world, and thank you very much for the director of the WHOAFRO to invite me for giving this short briefing. So in the last 2 years, Africa really increased the genomic surveillance in the continent. Yeah. So we have data for basically all member states of Africa. And quite important, yeah, it is that most of the regions are starting to do genomic surveillance at lower level, as everyone is doing the work, but at short turnaround time. So for example, this week, yeah, Africa passed 150,000 genomes that are open in GISA database, a public database, with our last genome coming from 18th of January 2023. So, and that both from, especially in the southern of the country that got introduction of XBB 1.2, running a very short turnaround time with less around 1 week, or what we call one epidemiological week, to know what has happened. Yeah. So what we know from the variants, from all the data in Africa. First, yeah, the variants that circulate is completely dominated by Omicron. Over 99% of the sequences are Omicron and its different sublineages. We have also detected the new sublineage from Omicron called the XBB 1.5, as the director of the WHOAFRO highlight. At the moment, we have 23 genomes of this variant that have been detected in Southern Africa, 4 in Botswana and 19 in South Africa, with the last ones coming from last week. Yeah. But despite the detection of this new sublineage XBB 1.5, which now is around 10% of the genomes in South Africa, we did not see exactly in the last 2 weeks increase on infections, hospitalizations, and deaths. And more recent data from South Africa released yesterday show that in the last epidemiological week, we start seeing again very low level of transmission and the first signs of really decreasing that. So we had an 18.1% decrease in the number of cases detected in epidemiological week 3, this means up to end of last week, compared with the week 2. And that's not related to lower testing. We saw a decrease in testing, but 10%, where we saw an 18% decrease in case despite the introduction of the XBB 1.5. Yeah. Why we are not seeing an increase in hospitalization, and that's especially in Southern Africa. And that's something that we have discussed very widely with our ministerial advisory committee. It's because we see a very high level of population immunity, yeah, and we see that this new variant, the XBB 1.5, could not drive a new wave of infection or hospitalization and death. Some of the activities that were suggested to increase in Africa, it is to try to increase the number of genomes, which both South Africa and Botswana have done, but also happen in Eastern Africa and Northern Africa. So for example, some of the activities of Ministry of Health in South Africa ask that every positive case to be confirmed by qPCR and made available for genomic surveillance in a short turnaround time. So we continuously focus on increasing and make sure that the genomic surveillance is happening in Africa. My own institutes, both in KwaZulu-Natal and Stellenbosch, support multiple African countries. And together with the WHOAFRO and the Africa CDC, we could scale genomic surveillance to all member states. Yeah. So at the moment, we are alerted for new variants. We have detected multiple introduction of XBB 1.5, but we are not concerned because the system for genomic surveillance is still working well, and we didn't see an increase of hospitalization and deaths. So thank you for the opportunity to do this short briefing, and I would be welcome any questions on the variants that have by any journalist in the next phase of this press briefing.
Thank you very much, Professor Tulio. Now I will turn over to Honorable Minister Jala from Liberia. Honorable Minister, can you please tell us how Liberia managed to achieve the high vaccine coverage for COVID-19? Welcome.
Oh, thank you so much. Good morning, Dr. Mueti and other platform guests. Let me bring you greetings from the Republic of Liberia this morning. And we want to thank the media and all those who were able to put this media engagement together. Liberia, you know, they did very well, not without the help of all of our partners. We had our share of problems, but once we began, it made it very easy for us. Our president set up Sparkle, which is a group that contained all of the ministers. So we started off with a multi-sectorial platform where every minister and every ministry was involved, especially the internal ministry that dealt directly with the community. So we had to go all the way down to all of our communities. We use our community health workers. We use our health partners within the different communities to speak to all of the people to tell them the importance of being vaccinated. And so as we spoke to them and we brought the vaccination to the public, we did not sit within the facility to wait for people to come to us. We went out to them, whether they were in their homes, they were in the farms or wherever they were. We reached out to them there to make sure that they received their vaccination. We also had our GSA director who had a special setup where when you come there was water, there was a good lecture for you. And so people took advantage of every corner that we had to reach them in. We also work especially with the schools for the school-based vaccine. So kids from 12 to 17, we went to their schools and made sure that they were involved, the principals, their parents, the PTA, everyone was involved in this campaign. And as long as we have vaccines available, then we could reach all of these people. So it was not an easy task, but we had to deal with vaccination inequity. We had to deal with some of the complications that were coming out from the media. So we had our media to engage people, to try to talk to them. We tried to tackle all of the different myths that were coming out about vaccines. So this was like an everyday work that we were out there in the field. Our nurses were being spoken to so they too can be vaccinated. So we have reached about 97% of the healthcare workers, because you cannot be talking to people to take vaccines when you yourself have not taken the vaccines. So we had to reach them in order to reach the public as a whole.
Thank you very much. Yeah, Honorable Minister.
No, I was saying thank you.
Okay, thank you very much for that encouraging update from Liberia. This shows that we can actually increase the vaccination coverage using innovative approaches. So now that we have heard from all our panelists, it is time for you journalists to ask your questions. To do this, please use the Q&A function on the Zoom platform. Tell us your name and the name of the media organization you represent. And on hand, we have additional experts to answer your questions. These are Dr. Tiano Balde, the COVID-19 Incident Manager. We also have Dr. Fiona Atuhebe, the Vaccine Officer. We have Dr. Patrick Otim, the Incident Manager for the Regional Cholera Outbreak Response. Paul, I understand you are lined up to ask your question live. Are you ready?
Yes, thank you very much. So I have a question for Professor Tulio. Beyond insights that we have from the genomic, from the sequencing of the various viruses, can we also have any do we have any genomic insights regarding how long COVID is playing out on the continent, considering the fact that we have paucity of data regarding Africans that are at risk of this? Then for Dr. Moeti and the Honorable Minister, one trend that we are seeing in a number of African countries is the reemergence of several outbreaks, especially those that are vaccine preventable. In Nigeria, there is an ongoing diphtheria outbreak, and in several African countries, including Malawi, they're also dealing with cholera. So can we attribute these to the impact of COVID disruption of Africa's vaccine programs, or what do you think can be as responsible for this reemergence of vaccine preventable outbreaks? Thank you very much.
Okay, thank you, Paul. Prof. Tulio, we'll start with you, and the Honorable Minister could complement after you.
Yeah, thank you. Thank you, Paul, for the question. Yeah. So on the genomics of COVID, normally we focus on the virus itself. Yeah, just to make sure that we have the capability to detect any new variants. Yeah, and unfortunately, there is not a genomic test for long COVID. Yeah, and that come more from the clinical analysis of the patients. Yeah. So on the genomics of the virus, what we know is that we have still Omicron circulating close to 100%, and that the new lineage that was emerged in the northeast coast of United States, the XBB.1.5, that caused initially a hospitalization in that area, was introduced here multiple times, but did not translation in a high increase of hospitalizations and infections, which it is good news for the people that tend to develop long COVID, because we didn't see a big wave impacted. But that's all that we can take at the moment from genomics and SARS-CoV-2 is to focus on the virus and understand the variants and correlated that if that increased transmission, hospitalization, or that which is not in the case in the beginning of the year of 2023. Thank you.
Thank you, Prof. Honorable Minister, do you want to weigh in on this?
Yes.
Okay, you are muted, Honorable Minister. Can we unmute the minister, please?
Hello.
Yes, we can hear you now.
Yes, could you repeat the question? I didn't really get the question.
Okay, Paul, do you want to repeat the questions? Okay, we'll come back to you, Honorable Minister. Let me take the next question.
Yeah.
Okay, this next question is on variants. It's coming from the Guardian. What variants are predominant in Nigeria and Africa, and what are the implications? I'll come back to you again, Prof. Tulio, to start with responding to this question.
Okay, yeah, thank you very much for the question. Yeah, so in the last close to the last year, we have only detected Omicron variant of concern with certain sublineages, and that's the ones that is coming in all the genomic surveillance, not only from Nigeria, from other West African countries, but for the rest of the Africa. So at the moment, we are still on the Omicron variant of concern with the different sublineages, yeah. On the ones that are more in the radar, the XBB.1.5 have so far only been detected in Botswana and South Africa, but without causing upheaval in hospitalizations or deaths, yeah. So we are quite confident, not only in Africa region, but the rest of the world, that at the moment we are still completely dominated by Omicron, and we haven't seen any new variant of concern emerging either in Africa or in other parts of the world at the moment.
Okay, thank you very much, Prof. Tulio. Dr. Moeti, I would like you to also comment on the issue of the impact of COVID-19 on vaccination. Over to you.
Yes, okay. Thank you very much for that question. I think we know that the COVID-19 caused severe disruptions, not only to immunization services, it certainly did for immunization services in many parts of our region and many parts of the world. So many vaccination campaigns for under 5 children, which is normally what is done to protect them from diseases like measles and also diphtheria that you mentioned, and other routine services, things like family planning services, access of women to safe deliveries in a health facility, for example, access to antiretroviral therapy, which is a very important part of healthcare in the African region. All of these were disrupted significantly by the lockdowns, by the absorption of the health system's capacity, by the COVID-19 response, and by people simply also being afraid to come to health facilities because they feared being infected with COVID-19. And we've seen an increase in cases of the diseases affected. Millions of children, for example, have been at risk of measles, yellow fever, etc. And we've seen measles outbreak in 20 African countries. That's quite unprecedented. So that's one of the issues that we can count as the impact of the COVID-19 pandemic. So a lot of work. At the same time as there was response to the pandemic, there was a lot of effort we supported with partners like UNICEF and other countries to try and find ways around the impact of the COVID-19 pandemic and its restrictions and to recover coverage and access to these services. So there have been reactive campaigns of including, for example, yellow fever and meningitis A, and of course, measles. There are many measles responses and campaigns happening around the region. And we've seen that not only have we managed to catch up, but we've also increased the numbers being vaccinated in 2022 compared to before the pandemic started. What I think, if we think about building back better going into the future, for example, for antiretroviral therapy, a lot of the service delivery then had to be done at the community level. And we know that the people living with HIV and AIDS are some of the most organized communities in our regions. And we are now trying to work with them to find ways for this expansion of the reach of our health services to be sustained beyond the end of the COVID-19 pandemic, because that's a way in which we can find other channels for increasing access to care. So no doubt that there's been a big impact on communicable diseases through vaccination being stopped. A lot of work has been done to catch up, and we hope to use some of these catch-up strategies to sustain the expansion of the reach and to reach what we like to call zero-dose children who've never managed to be vaccinated with anything. Sometimes we try to reflect on the negative impact of the pandemic. We've learned a lot. We've built a lot of capacity. We've expanded the reach of our health services, and I think this is something that we need to carry into the future. So we increase access generally. Thank you.
Thank you very much, Dr. Moeti. Honorable Minister Jala, do you want to comment from the Liberia perspective on the impact of COVID-19 on vaccinations for other communicable diseases? Okay, Dr. Fiona.
Yeah, one of the things that happened right in the beginning was that the negative impact that got to the media impact that hit all of the health centers and all of the families. So everyone was afraid to take any vaccines because they thought that the COVID-19 were being given to them through the vaccines. So nobody went to the health facilities for vaccines. So we had to do a lot of work later on during the COVID-19 to gain the confidence of the population to be able to start coming to bring their children. But then it was too late we had already had so many children that did not have measles vaccines and other vaccines. So therefore, we were one of the countries that had the outbreak of measles. And because of the decline in the people that were supposed to be going for other services, we saw an increase in communicable diseases and other diseases. So this is a lesson learned from the COVID that we need to really use our community. We need to really encourage our people to continue going to the health facility as we encourage our healthcare workers to make sure they are protecting themselves so that they can be able to take care of other conditions and not let it go as far as it went. Thank you.
Okay, thank you very much. Dr. Fiona, do you want to compliment just briefly, and then we move to live questions?
Thank you, Mary. I think the Honorable Minister did justice to this question, but just to add that we've seen an unprecedented trend of outbreaks in the region. But not only that, we've also seen a lot of hesitancy that came with other campaigns, that mothers did not take their children for polio campaigns when they got to know that, for example, it is an integrated campaign. But as she mentions, with more and more education, we seem to be seeing this trend changing. Thank you.
Thank you, Dr. Fiona. Erin, are you ready with your question?
I am.
Yeah.
Yes.
Go ahead, please.
Thank you so much. This is Erin Prater with Fortune Magazine. These questions are for whoever might want to take them. The WHO Emergency Committee is set to meet on Friday to determine whether or not to extend the public health emergency of international concern. From the standpoint of Africa, does COVID still qualify as a pandemic, or is the continent more at an endemic stage? And part two of my question is, Africa appeared to fare better than other continents with COVID. What are the reasons for this, in your opinion? Is it due to cross-reactivity to an exposure to a previous coronavirus or a different coronavirus, or is it simply a matter of underreporting? Thank you.
Thank you, Erin. Dr. Moeti, I will start with you. Then Dr. Bade, you can prepare to add.
Okay, thank you very much. Yes, indeed, the emergency committee is meeting and will determine on a global level what to advise and what to declare, which will determine then what happens in terms of continuing measures to contain the spread of COVID-19 pandemic around the globe. I mean, I think, you know, there's just been a very severe outbreak in China, for example, and we're seeing in some Western countries again, cases starting to increase. We're saying here that in our own region overall, we have not seen the kind of uptick we've seen at the beginning of the year after the festive season for the last few years, but we have seen increases in some countries which have not produced the kind of devastation that we've seen as a result, say last year. So I think overall, all of these factors will need to be taken into account. No doubt there'll be consideration as well of matters like the level of vaccination worldwide, the level of boosting worldwide. Our region has caught up significantly, but you know, we still have quite a large number of our population not having received boosters. We still have to catch up in quite a few of our countries on the most vulnerable populations. So I believe a determination will take into account all of this, the global picture. I think what's very important, as we said before, is the local interpretation and the ensuring that based on local data, we are able to ramp up the response when it is needed in a country and even within a country at the subnational level. We will follow, of course, the global guidance in terms of continuing to do certain things. Certainly the surveillance, the sequencing, the exchange of information among countries is extremely important because it's critical that when a new subvariant or variant that may carry more risk emerges somewhere, the rest of the world is aware as early as possible. So we will follow the guidance of the emergency committee in that way. I think the impression that Africa fared better, why that might be the case. We believe there are multiple factors. Certainly, there is the fact that because of the pattern of infectious diseases, there may have been exposure to similar viruses in the past in African countries, and therefore to a certain level of immunity. But we also know that one of the driving factors of the pandemic's trajectory was international connectivity. We saw that the countries that ended up as kind of epicenters, we might say, of the pandemic in Africa were South Africa, and in the northern part were some of the northern African countries that are very intensely connected in terms of international movement of people, and also that have the internal infrastructure for intensive movement of people, because the virus is carried in the bodies of people. We have a population structure, it's been said many times, where we have a young population in African countries. So even if people may have been exposed to the virus, infected by the virus, the pattern of severe illness has not been, for example, the same as we saw in countries with elderly populations, and particularly with significant proportions of elderly populations being looked after in the kind of care homes which were severely struck by the population. We have a largely rural population in African countries, even if we're urbanizing quickly. And we saw that the majority of so-called outbreaks of the virus were largely in urban areas. And then, of course, we've had exposure in general of our population, but less in the way of deaths. I think we shouldn't come away with the fact that it was all by dint of luck. African countries responded very early. African governments imposed restrictions on the movement of people, which have proved to be very costly as far as economies are concerned, but which did play a role in slowing down the spread of the virus. So we think all of these factors played a role. And what I think is very important now is for us to see what are the capacities that were built up during this pandemic. What do we need to do to sustain those capacities, working in line with all the discussions about pandemic preparedness and the investments in pandemic preparedness that are going to take place, and connecting that with making sure that we have resilient health systems that can deal with other illnesses. So if we count the cost, it may be that the pandemic did not impact our region as badly as it did as far as COVID itself is concerned. But as we've just said about vaccination, it had multiple negative health impacts and really, in some cases, devastating economic impacts in Africa. Thank you.
Thank you, Dr. Moeti. Dr. Tiano Balde, do you want to weigh in?
I think really Dr. Moeti has said it all, maybe just one or two additional element. I think it's also some of the response capacities, which has been acquired by some of the African countries. Over the past, decades, we have seen, some kind of outbreak which were happening in most of these countries. So there was a kind of habits, there were a kind of, capacities which were already existing, both at the national level, but also at the local level. So the level probably of readiness or not that much of panic, might have also helped definitely African countries, to cope with this situation. The other point is also about also the low level of these comorbidities, which we know also have impacted a lot, I think, in terms of the severity of the disease. So the fact that we don't have that much of population or who are carrying these comorbidities also might have helped us for really getting where we are and having the result that we have had. On the first question, just to add, Dr. Moeti also have said it, there will be the emergency committee this Friday, and at the moment, the risk assessment which has been conducted is showing still, that the level is, the risk is quite high at the global level, but there is definitely the particularity of Africa, and what is the most important aspect is here to adopt a certain level of agility and adaptability, and to adjust, our response capacities and our response actions, in regard to the epidemiological trend. And for the past few months, we have seen really a kind of low level of transmission, low level of cases, low level of admission in hospital, most importantly. So that means, we can also try definitely to manage the outbreak, in a different way, while also dedicating some of the efforts and resources to other public health issues. Thank you, Mary, and back to you.
Thank you, Dr. Baude. Prof. Tulio?
Yep, thank you. Just to add that one thing that helped a lot South Africa, especially in the Omicron wave, and that was around end of November, December last year, is the early detection of the variant. Yeah, we detected this variant when cases were really low and we could follow the signs of increase. And if you can do that and maintain good genomic surveillance of detection of early pathogens and variants, you can help to prepare your health system. So in South Africa, on the Omicron wave, we didn't have a lack of oxygen, we didn't have a lack of healthcare workers, and we didn't have a lack of beds. That was all prepared within a few weeks in advance. And that was so important, all the investment that have been done by the WHO, the WHOAFRO, the Africa CDC, and governments on increase the early signal of new pathogens and genomic surveillance. And that's something that we did relatively well. Of course, it can improve, yeah. But something that we are focused, because we saw the result, at least with the Omicron, the two Omicron waves, the BA1 and the BA5, that we detected very early, and we could make sure that we had the resources to deal with that. Thank you.
Thank you very much, Prof. Tulio. So definitely multiple factors that contributed to the successes in the COVID-19 response on the continent of Africa. So the next question is to you, Dr. Patrick Otim, and this question is coming from Politico. Have countries where Mpox is endemic in Africa been asked for access to monkeypox vaccine? The vaccine manufacturer says they have not had any requests from African countries for the vaccine. If that's the case, why? Dr. Patrick Otim?
Thank you, Dr. Mary, for the question, and thanks to the journalist who has asked it. I think the issue of access to vaccines for Mpox has been very, very critical. From last year, when the outbreak was raging globally, a lot of the countries reached out and asked for vaccines, but the access then was a problem because doses were very, very low. And most of the countries had procured the doses that were available. So currently, as the epidemiology is evolving and cases are declining, we are beginning to see doses being made available. So on the African continent, the countries that have reported monkeypox cases before, that is the DRC, Cameroon, and Nigeria, have already reached out to WHO and asked for support with vaccines. And what we have been doing is engaging with other countries that have stocks of this vaccine that they have procured, which they are willing to donate. So the last 2 weeks, we have been facilitating these discussions with bilateral discussions between these countries and the other countries that are willing to donate to them vaccines that they can be able to use. But I think I must also state that these vaccines can only be used in the context of a clinical trial. So countries are working within that arrangement to ensure that they have protocols developed and they have regulatory approval so that they can be able to use the doses that are now becoming available. So it's not as if the countries are not willing to get, but I think they want to start, and the fact that the approach is a primary preventive vaccination. So they are working with the doses that have already been offered to them. And after that, probably other countries, depending on the resources that they have, considering all the public health priorities in those countries, they may be able to reach out and procure vaccines. Thank you.
Thank you very much, Dr. Patrick Otim. And this next question is coming to you, Dr. Fiona. The question is from Odile with Radio Node. Which countries are already producing vaccines? Are there other African countries who could start producing vaccines? To do so, are African countries open to foreign cooperation? Fiona, and I think Dr. Moeti can also add.
Thank you very much, Mary, and thanks to the journalists for this pertinent question. So for a number of years now, we've had Senegal producing the yellow fever vaccine. It was the country that was producing vaccine on the continent before we started before COVID pandemic came in. Egypt also started the manufacture of COVID vaccine. South Africa, as we know, also came in to do the fill and finish. But as we know, as we talk of manufacturing has several steps in manufacturing. So even when we hear in the Western world, different countries are doing different steps of the manufacturing. Rarely do we have one site doing all the processes. So even when we mention Egypt, we mention South Africa, Rwanda is also about to start. And the journalist also asked about external corporations. Yes, we have been very open, and then the linkages have been done. I'm sure Dr. Moet will say more about that with the TRIP agreements. We also have Ghana that also put in a request. A number of countries have shown a lot of interest in manufacturing on the continent at different stages of manufacture. But again, like I mentioned, Senegal has been manufacturing the yellow fever vaccine. It's also one of the countries that have put in requests for messenger RNA. South Africa is there. Rwanda is in the queue. Ghana is also in the queue.
Dr. Moeti, do you want to weigh in?
Yes, I think without going into a lot more detail, I think it's true to say there is a movement now on local production of vaccines on the African continent. And if we count, what has been the outcomes, what will be the legacy going forward of the COVID-19 pandemic, certainly that movement is one that I believe is going to concretely translate. Fiona has already indicated the number of countries, and it's very much a partnership between African countries, other countries at the international level. The European Union has been one of the leading, if you like, partners of Africa at the political and technical level that is supporting this move, as is the United States. So I believe that a number of countries, Senegal, which was already producing vaccines, we have a number of North African countries that have been producing vaccines and medicines, Rwanda, South Africa, of course, that has already been producing and exporting vaccines as part of the initial response to the COVID-19 pandemic. I believe that the production of vaccines on the continent is going to expand, of course, triggered very much by the COVID-19 pandemic, but also to expand to other childhood vaccines. Africa is one of the biggest consumers and users of vaccines for under 5 children. And I believe there are discussions going on indeed with investors, because this vaccine production cannot only be an undertaking of the governments. There is a need to involve private investors. There is a need to show that there's going to be a sustainable market for these products. And certainly with the type of population that we have in Africa, there is a market for these vaccines for under 5 children. Partners like Gavi are part of the conversation. And very much the African Union as a political entity, gathering the political determination of African leaders that never again should our region be found, or our continent be in this situation of being last in the queue for accessing key tools to respond to a pandemic like vaccines, as unfortunately became the case when challenges arose in access to these vaccines. So to me, it's a very exciting time, determination to produce for ourselves, need for partnership with private investors, work with international partners, and very much led at the political level by political leaders within the African Union. So it's something that we are looking at supporting, we're engaged in as WHO, looking at supporting very strongly, particularly the regulatory and capacity building aspects of this work. Thank you.
Thank you very much, Dr. Moeti. And this next question is coming to you, Professor Tulio. The question is from Moga Kamal Yani. As we know, detection of variants and virus changes and prevalence depend on testing. Is the current testing for COVID-19 enough to increase the testing and sequencing? Let's start with you, Professor Tulio.
Yeah, thank you. That's a very important question. Yeah, we do need a diagnosis, yeah, and a sample to produce genomes. Yeah, so if samples do not exist and they are not being diagnosed, we cannot produce genomes. Yeah, one thing that we saw was not only in Africa, but everywhere in the world, it decreased the testing. It decreased to really low levels compared with the previous 3 years of the pandemic. Yeah, interventions that one can do, and it is happening in many countries in Africa. It is first to put the genomics sequence unit close to the diagnostic lab. So for example, recently detected the XBB 1.5 in Botswana and in South Africa. That's when you have a genomics facility working very close collaboration with a national public health testing facility. So samples, any positive samples can move, yeah. Other things that can happen, yeah, for example, the government of South Africa, the ministry, they send a policy that every single positive case that is detected in South Africa by antigen, should the same sample or a new sample be sent to a national public labs to do a confirmation on qPCR and doing sequencing. So we did that in the last 3 weeks, yeah. And even despite with lower cases, yeah, we have increased the genomics number of genomes being produced every week in South Africa. So that is the kind of advice that we are putting to direct to our governments or to the WHO and Africa CDC to suggest governments that even with lower testing numbers, to make sure that we can prioritize samplings to be sequenced, yeah, so we can know what is happening in the continent. The recent intervention in South Africa have increased the number of the genomes per week, yeah, decrease the turnaround time, and we are suggesting that to other countries to always every week select samples and make sure that we have a genome so we know what's happening in the continent. Thank you.
Thank you very much, Professor Tulio. Dr. Barde, do you want to add from the perspective from the regional level on increasing testing for COVID?
Yes, thank you very much, Mary. Indeed, I mean, this lower testing, we have seen it, I mean, for the past few months, but as we have already said, it's quite very important to maintain an optimum level of testing, I mean, in our countries. And Professor Tulio have mentioned the importance of linking the testing with the sequencing. But more than that also, again, I mean, really reaching, trying to go and to do more testing at the community level. And when I'm saying community level, also at the point of entry of the health system at the clinics, targeting mostly the most vulnerable people. So engaging more, both communities, but when I'm saying communities, this can include also the community of practice, the medical doctors, I mean the nurses who are working in the different clinics, to sensitize them a little bit more on doing more on the testing on the COVID-19, both for detecting new cases, but also for monitoring the evolution and the trend at the very local level. And today we have a very interesting tool, the antigen RDTs, I mean, which WHO has been, I mean, really procuring and distributing to most of these different countries today, I mean, to be used. And those antigen RDTs can detect at the moment almost all of these sublineages. So it's quite a very effective tool, I mean, to continue, I mean, to be used, I mean, for really detecting the different cases which can happen. And obviously then after that, to conduct also this sequencing aspect. So I think really there is the technical aspect, but there is also all of the other aspects related, I mean, to the logistic, to the capacity, to the to explaining and engaging more both the communities of practice to accept and to continue doing, I mean, this testing and maintaining an optimal level of testing at this period of the transition, and to avoid, I mean, missing, I mean, some of these elements which can lead us, I mean, to some situation where we don't want to be. Thank you, and back to you, Mary.
Thank you very much, Dr. Barde. Wilfried, are you ready to ask your question live? Wilfried? Yeah, can you ask your question, please? Wilfried. Okay, so I'll come back to you. Just get ready. We can't hear you. Can you speak now?
Oui, en fait, ma question ça va être adressée à la directrice régionale. Nous avons l'information où, avec l'actualité que nous suivons, la Chine a encore connu une vague tellement importante sur la contamination de Covid. Ma question est de savoir, est-ce qu'au regard de cette vague-là, le nombre de contaminations, peut-on encore croire que le monde peut encore revenir en arrière avec le nombre de contaminations qu'on a connu au début de la pandémie?
Okay, this question I will give to you, Dr. Balde. You can respond.
Maybe Dr. Moeti can start and I can continue.
Okay.
Yeah.
OK, merci beaucoup. Merci pour la question. Oui, c'est vrai que la Chine a eu une situation très particulière d'une vague de Covid assez sévère à l'intérieur de ce pays, liée un peu à l'ouverture des mouvements dans ce pays. Ils ont continué à ouvrir la situation. Je crois que maintenant, la situation la plus grave est derrière la Chine un peu. Ça commence à s'améliorer un peu. Je crois que nous sommes arrivés à, comme nous avons déjà dit, à avoir la capacité de détecter partout dans le monde, y compris dans nos pays africains, s'il y a une augmentation de cas, s'il y a une augmentation liée à la situation en Chine de cas de COVID-19. Je crois que ce qu'ils ont fait, ce qu'ils continuent à faire pour comme intervention au niveau des personnes qui voyagent peut éviter que la situation soit diffusée au niveau de tout le monde, y compris l'Afrique. Mais comme nous venons de dire, nous avons maintenant établi la capacité dans la plupart des pays africains. Nous pouvons, comme on dit, augmenter les interventions le dépistage, etc., si nécessaire dans les pays africains. Ce que je peux ajouter, c'est que pour continuer, nous avons vu que le dépistage a beaucoup diminué. Nous pouvons faire ce que nous appelons le sentinel surveillance, suivre quelques groupes de façon régulière pour voir surtout les groupes à risque aux maladies sévères pour s'assurer que nous ne voyons pas l'augmentation de cas de contamination de ces personnes-là. C'est vrai, nous devons réfléchir à ça. La situation est en train de s'améliorer un peu en Chine. Je suis à Genève, comme a dit le collègue. J'ai parlé brièvement hier avec un collègue du ministère de la Chine qui est ici aussi, qui m'a donné les dernières informations qu'ils ont eu une situation très, très grave en Chine. Ça commence maintenant à s'améliorer. Nous restons vigilants en Afrique avec le système, la capacité de augmenter le dépistage et le suivi et la surveillance si nécessaire. Et j'espère que ça va nous aider à suivre et réagir dès qu'il y a une augmentation de cas. Merci. Dr. Balde, vous pouvez compléter maintenant si vous pouvez.
Merci beaucoup, Dr. Moeti. En fait, pour aller directement, en plus de ce que Dr. Moeti a dit, c'est qu'on n'a pas vu et on a vraiment tous les outils aujourd'hui qu'il faut pour pouvoir suivre l'évolution de ces situations, qu'il y ait une augmentation de cas ou de décès. Et depuis que l'on assiste à la situation, comme on l'a dit, malheureuse en Chine aujourd'hui, on n'a pas vu cette augmentation, que ce soit ici en Afrique particulièrement. Il y a eu des augmentations dans d'autres pays de l'hémisphère nord, notamment en Europe et aux États-Unis, mais c'est des choses qui arrivent surtout avec la situation hivernale. Il y a eu des combinaisons de plusieurs phénomènes, non seulement la COVID-19, mais aussi des épidémies d'autres virus respiratoires, donc qui ont entraîné peut-être une certaine augmentation des cas, une tension sur le système de santé, mais aujourd'hui que l'on voit qui est en train de se résorber progressivement dans tous ces pays. Donc, il y a un optimisme quand même qui est là aujourd'hui et la surveillance, elle est de rigueur et je pense que tous les efforts sont faits dans ce sens-là. Merci.
Merci beaucoup, Dr. Balde. So now we are going, and merci, Dr. Moeti, to the Honorable Minister from Liberia. This question is coming from Abdullah. He's from Radio Tanda. What justifies reducing protective measures in Liberia and also in other countries? From COVID, measures from COVID, yes.
Protective measures from COVID, that's the question.
Yes, what justifies reducing, because a lot of countries have removed some of those measures. So Abdullah is asking, what is the justification?
Well, the justification should be that the number of cases decrease due to the fact that you are testing. Most of us are not testing or very widely. We are using some type of enhanced surveillance to see within the community how many persons are coming down with COVID, which we are finding that a lot of them are negative. We are not testing at the airport, but with this new antigen test, I think it would be a good way for us to use as a protective measures for the country. And as they improve our ability to sequence, once we know that we still have Omicron as the dominant variant that's not showing any type of symptoms that we have to hospitalize our people, then that's enough that we can go on as we wait for the conclusion from the meeting. But we haven't put all our guards down yet. We are still under surveillance or as we go on as a protective measure towards the population. And then increasing your vaccination rate, especially around the younger people, which we are starting as of tomorrow from 5 to 11. So we're going as low as that. That will increase the protective measures from COVID as we encourage them to all take their boosters. Thank you.
Thank you. Dr. Moeti, do you want to weigh in on this?
Yes, I think, I agree very much with what the minister has said. And I believe we need now to define to countries more clearly what are some of the continuation of, if you like, the vigilance, the surveillance measures that will be able to detect any upticks in a way that builds on the already established surveillance systems that we have put in place in the countries. You know, we have the integrated disease surveillance and response. That's been our key strategy for disease surveillance in Africa. So how can we connect the needs of COVID-19 to what's already being built up in our countries so that we can quickly detect and respond in the way that the minister has said as needed? And just to say that the control measures of COVID-19 have been, of course, necessary, but they've come at a huge expense for other aspects, including other diseases, as I said, in relation to cases of measles, meningitis, and others in the region. So this always has to be weighed up. I think we now have sufficient experience in some of the countries and increasingly in other countries about the way in which we can increase as locally as possible the control measures as needed, and then make sure that we resume the normal surveillance and we resume normal health interventions, and we, most importantly, resume normal socioeconomic activities in countries, because we always have a balancing of those costs, which on our continent have been extremely high in terms of the pandemic. So we haven't altogether abandoned everything. I think we need to define more clearly and ensure that the basic surveillance is there and the capacities are being built. As WHO, we have a program where we are supporting countries now to train their own internal healthcare workers to be able to respond quickly to a pandemic, to sustain and improve the laboratory services. So one of the outcomes of the pandemic has been this increase in capacity, and we're in about 20 countries now in Africa. So the situation, the capacity to respond is very different from the way it was 3.5 years ago when this pandemic started. And that's what we will take forward as we encourage living with the virus, ensuring that the capacity is there, the surveillance at the basic level is there, including for variants, and the capacity to ramp up a response is in place as and when needed. Thank you.
Thank you very much, Dr. Moeti. And now we are coming to the end of this presser. At the end of the press conference, Dr. Tiano Balde will still stay behind to answer some more French questions. So now I will turn back to our panelists to give us their final thoughts. I'm starting with you, Professor Tulio. Your final message, please.
Yeah, thank you. So our final message is that we invest a lot of time and resources as a continent to increase the lab facilities for both diagnostic and genomics. And now we are working as hard on that to make sure that we still survey COVID for the variants, but that we use the same facilities and the same expertise and equipment to also survey other important diseases. Yeah, so Africa aim, at least on genomic surveillance of pathogens, to be on the forefront and make sure that we can quickly detect and characterize new pathogens and new variants in real time. And we do that together as a continent, support of funders, but also in very close collaboration with the WHO and the Africa CDC in a very comprehensive consortium and network that was one of the positive aspects of this terrible pandemic. Thank you.
Thank you very much, Professor Tulio. And now I turn over to you, Honorable Minister Jala, your final message, ma. Honorable Minister. Okay, you are muted. Please unmute yourself. Can I have the minister's microphone muted, please? Okay, you can talk now. Yes, we are good.
Okay, so I wanted to say a big thank you to all those who on the panel, Dr. Moeti, and all of the information that we received. We just want to encourage all of us in Africa to make sure we have our joint external evaluation done. We have a plan for emergency preparedness, and we all save a little bit of money so that in case there's any kind of epidemic or pandemic, at least we can start before the other countries come in to help us. And that we encourage everyone to make sure that they take their vaccinations, their booster, and we get the capacity to be able to do sequencing on all of these new diseases, and that we keep our routine services going so that we do not fall behind on other diseases, and that we all remain healthy, and also that those countries that have been given the opportunity to produce vaccines, that they be supported to produce vaccines so that we are not on the third list for any of the vaccines come any other pandemic in the world. Thank you.
Thank you very much, Honorable Minister Jala. And finally, over to you, Dr. Moeti, for your final message.
Okay, thank you very much. First, I'd like to sincerely thank my fellow panelists, Honorable Minister Jala and Professor Tulio, for joining us today and for the work that you have done. The Minister of Liberia for showing the example that it was possible, very much using the approaches that you told us about, working through communities, engaging with the people to mobilize people to be vaccinated in Africa. And I'm quite certain that this is an experience and capacity that you're going to take forward for all other aspects of health. And Prof. Tulio, thank you for the work that you've done. And I can't but agree with where you ended up. One of the things that is a huge opportunity for us is to leverage all the capacities built, all the experiences of this very difficult 4 years of the COVID-19 pandemic for health more broadly. The connections, the partnerships need to help us move forward very much into the future more broadly. I'd like to echo that we've worked very strongly with the Africa CDC, and we have very much appreciated the political leadership of the African Union. And that's an example, again, that we need to take into the future very much for health and development. I'd like to say that from the perspective of WHO, we would like to consolidate with partners all this experience, the connections. We believe what we are doing in preparedness, preparing for the next pandemic, including some of the discussions going on at the global level, what we have done and the investments in the response to a pandemic indicate a strong connection across health problems with strong health systems, starting again at the community level, as shown in the Liberian experience, going to the district level, that we need to pull together all of this so that we are able to prevent health problems, we are able to respond to pandemics early, detect them early, and then we're able to provide healthcare to people even during a very severe pandemic. For me, if there's anything that we've learned from the pandemic, is to make these connections in terms of our investments, our engagements, and our partnerships so that we don't work in isolation on different components of health. They are all connected, and finally connected around people. So going back to the community level so that they understand their role, they play their role in everything, including coming forward for testing, coming to be vaccinated, spreading the right information. That's what we'd like to achieve in WHO. Finally, about spreading information, I'd like to thank our journalist colleagues so much for the work that you do and for having joined us today. And we hope to continue this partnership with you. Thank you, everyone.
Thank you very much.
Yeah, I just to say, I think we're finished with the English.
Thank you very much, Dr. Moeti. And we have now come to the end of the press conference for today. We want to thank all our panelists, thank all the journalists for all the good work, and thank you for joining us today. Once again, Happy New Year to you all. Have a nice day. Thank you and bye.
Mais pour les journalistes francophones, nous avons une session de 10 minutes à peu près, si vous avez des questions pour Dr. Barnedas.
Bonjour, nous allons poursuivre avec la session en français avec Dr. Tieno Balde. Il est le responsable des opérations de riposte à la COVID-19 au bureau régional de l'OMS pour l'Afrique. Moi, c'est Kay Lawson, je suis chargée de communication au bureau régional. Bonjour, Dr. Balde, vous êtes en ligne?
Oui, bonjour.
Merci. La première question nous vient de Abdoulaye Ouattara de Radio Tanda. Il aimerait savoir ce qui justifie la baisse des mesures barrières ces derniers temps.
Merci beaucoup. Je pense que la question avait déjà été répondue, mais je pourrais peut-être revenir un peu sur qu'est-ce qui explique cela. Ça fait déjà quelques semaines et quelques mois que l'on constate vraiment une diminution vraiment régulière du nombre de cas et du nombre de décès dus à la COVID-19. Donc, et comme toutes ces mesures-là restrictives-là venaient aussi avec donc un impact très important, un impact économique, un impact financier, un impact social. Donc, il a fallu donc s'adapter. Donc, la plupart donc des pays africains ont dû donc prendre certaines mesures pour pouvoir alléger les mesures donc ces mesures barrières-là qui étaient mises en place pendant toutes ces dernières années-là pour pouvoir continuer à faire fonctionner la société normalement. Par contre, ce que nous rappelons, c'est que malgré cette baisse-là, il nous est absolument important de pouvoir maintenir vraiment un degré de vigilance et puis de maintenir les capacités en alerte pour pouvoir répondre assez rapidement et de façon très, très opportune à toute éventuelle augmentation du nombre de cas et du nombre de décès. Et je pense que c'est ce que l'on voit aujourd'hui un peu partout dans de nombreux pays en Afrique. Merci à vous.
Alors, docteur Balde, doit-on comprendre que la COVID-19 est finie?
Non, on ne peut pas le dire là. Je pense que nous suivons tous l'actualité dans le monde entier. Vous savez, on est dans un monde extrêmement interconnecté aujourd'hui. Ce qui arrive dans d'autres régions qui ne sont pas donc en Afrique ici peuvent affecter l'Afrique et vice-versa aussi. Si des choses arrivent ici en Afrique, elles peuvent se répercuter dans d'autres régions du monde. Donc, malgré que l'on observe donc cette diminution importante du nombre de cas en Afrique ici, qui s'est caractérisée, comme je vous le dis aussi, par une baisse des admissions et des hospitalisations, il reste qu'il y a d'autres parties dans ce monde-là aujourd'hui qui font face donc à une augmentation importante du nombre de cas. On a tous suivi, on est tous en train de suivre pendant ces dernières semaines-là la situation en Chine, mais aussi la situation dans d'autres pays de l'hémisphère nord actuellement qui font face donc à l'hiver, donc avec non seulement donc la COVID-19, mais aussi les autres virus respiratoires, donc qui peuvent entraîner des problèmes très importants. Donc, il est très, très important que nous puissions garder cette alerte-là. Et au niveau de l'OMS, on a un comité qui va se réunir donc cette semaine-là pour pouvoir réanalyser la situation. Donc, on fait ça de façon très, très agile. Donc, on réanalyse la situation à la fin de cette semaine et on prend des décisions donc au niveau global. Mais une fois que ces décisions aussi sont prises au niveau global, il faut pouvoir donc les adapter et les ajuster à un niveau plus régional, à un niveau beaucoup plus national. Et la chose la plus importante, c'est qu'il nous faut avoir une certaine flexibilité, une certaine agilité pour pouvoir adapter et mettre en œuvre les mesures les plus opportunes par rapport à la situation qu'on rencontre, que ce soit dans un district sanitaire, que ce soit dans une région d'un pays ou bien que ce soit dans l'entièreté d'un pays.
Donc, ça veut dire qu'il y a des actions qui sont mises en place au niveau de la région pour poursuivre cette tendance de baisse des cas de COVID-19?
Oui, absolument. Le bureau régional ici de l'OMS, depuis le début de cette pandémie-là, donc a mobilisé énormément de ressources, énormément d'expertise. Nous avons aussi beaucoup appris pour pouvoir accompagner tous les pays de la région, donc pour renforcer, pour répondre à cette pandémie-là. Et tout à l'heure, le docteur Moïti, notre directrice régionale, l'a mentionné. Ces efforts-là, ces ressources, ces expertises-là ont permis aussi à pouvoir adresser d'autres problématiques de santé publique aujourd'hui. Et je pense que c'est la tendance vers laquelle nous devrions aller. Donc, il nous faut aujourd'hui là continuer à maintenir ces différentes actions-là, maintenir ces différentes ressources-là qui ont été mises à notre disposition pour avoir donc des approches qui sont innovatives, qui sont agiles. On parlait tout à l'heure, par exemple, de ce projet communautaire-là, parce que les épidémies, elles commencent dans les communautés, elles se terminent dans les communautés. Et compte tenu un peu de la nature de la pandémie en Afrique ici, qui s'est manifestée avec pas énormément de cas sévères, donc toutes les choses se passer un peu dans la communauté. Donc, il est important, par exemple, de renforcer notre réponse au niveau des communautés. Donc, engager beaucoup plus les communautés pour que non seulement elles puissent répondre à temps à cette épidémie-là, à cette pandémie de la COVID-19, mais aussi à toutes les autres problématiques de santé publique qui peuvent arriver donc dans le futur. Donc ça, c'est important. Donc oui, les efforts vont continuer, elles doivent continuer et l'appui, les ressources doivent accompagner donc ces efforts-là pour pouvoir accompagner les pays-là dans cette période un peu de transition ou de la pandémie.
Donc, est-ce à dire que les pays africains ont-ils désormais une meilleure capacité de réponse en cas de recrudescence de la COVID?
Ça, définitivement, je pense qu'il y a eu énormément de capacités qui ont été vraiment construites, qui ont été qui sont maintenues. Il faut l'enjeu là, c'est comment les maintenir quelque part, parce que vous savez, par exemple, en Afrique, on a jusqu'à maintenant environ 5 vagues successives et on a vu au fur et à mesure qu'on avançait dans ces vagues-là, les gens s'habituaient. C'est la nature humaine. Je pense qu'il y a de l'expertise qui s'acquiert, donc il y a de l'expérience qui s'acquiert. À chaque fois, on construit sur les expériences, donc des vagues qui sont passées. Donc, il y a où on était en 2020, clairement, on n'est plus là à ce niveau-là. Les ressources ont augmenté, l'expertise, elle a augmenté, l'attention, elle a augmenté. Et chose importante aujourd'hui, la santé publique, les enjeux de santé publique aussi sont mis un peu au devant, un peu des agendas politiques, parce que quand on a vu ce qui s'est passé avec la pandémie, tout le monde a compris l'importance un peu des enjeux de santé publique. Ça aussi, c'est un gain très, très important. longtemps. Tout à l'heure, le professeur Tullio mentionnait un peu tous les partenariats qui se sont créés, le développement des capacités de surveillance génomique, c'est des choses extrêmement importantes. On était très bas. Quand on commençait cette pandémie, on n'avait que 2 laboratoires qui étaient capables donc de pouvoir donc diagnostiquer ce virus-là. Maintenant, on en a dans tous les pays donc d'Afrique. Aujourd'hui, on en a même au sein des pays plusieurs autres laboratoires qui sont capables de le faire. Et cette technologie-là, cette capacité-là, cette expertise peut être utilisée aussi pour d'autres maladies. Et peut-être pour finir aussi, toutes les ressources humaines qui ont été formées, les capacités, les personnes qui ont été identifiées, qui ont été formées, qui ont travaillé sur cette pandémie-là. Donc tout ça, c'est des acquis qui sont extrêmement importants.
Merci donc, Dr. Tierno Baldé, pour avoir été des nôtres pour cette session en français. Donc, merci beaucoup à vous, docteur.
Je vous remercie. Au revoir.
Au revoir et à la prochaine. Bye.